So over here, we are talking about the acute kind of the vision loss. And when we just focus on the unilateral causes of the acute vision loss, obviously history taking is again very important. The management starts right away when you have that patient at your hand and you have started taking the history from that patient. The ophthalmic history over here is the mainstay, of course, but you'll start off with the patient particulars, of course, ranging from the age, the gender, the occupation of the patient. It is the mainstay when you're taking the history from that particular patient. Then when we focus on the causative factors of the acute kind of the unilateral vision loss, the systemic history is again very important. If the patient is suffering from some sort of a medical condition that has to be highlighted over here. It can be the diabetes mellitus, hypertension, hypercholesterolemias. So these are some of the medical conditions that can raise this emergent or this urgent condition which is characterized by an acute kind of a visual loss in that particular patient. Usually you're going to basically differentiate just by knowing whether he or she is suffering from a bilateral or a unilateral visual loss. Bilateral visual losses, the causative factors are usually the toxic symptoms of any toxic substance that is present in the blood, or it is usually the occipital lobe that is involved in the bilateral causes. The unilateral, the major causes are the macular degeneration, the retinal detachment. We have the optic neuritis that can be of the inflammatory or of the non-arthritic type of the optic neuritis. These are basically, again, we can basically categorize these unilateral causes into the painful and the painless causes of the development of the acute vision loss in a single eye or unilaterally. So again, the cornea, the anterior chamber, the lens, and the retina or the optic nerve. These are the anatomical structures that can be involved in the development of the unilateral kind of an acute vision loss. Glaucoma is usually characterized by the painful condition that is usually experienced by the person. So we can usually differentiate from the painless and the painful causative factors of the development of the acute kind of the visual loss in the patient. The fundoscopic findings are again very important over here when we look at the acute kind of the unilateral vision loss in the person. What are we going to focus on when we look at the fundus or when we look at the retina of the patient? Usually the instrument that is used for the ophthalmoscopy is the ophthalmoscope or the fundoscope. The usage we've already discussed in the eye examination and is used to look at the optic disc, at the optic nerve. The healthy optic nerve and the healthy optic disc has to be distinguished from the inflammatory kind of an optic nerve, and then the vessels in the retina have to be focused on when we are looking at the fundus of a patient. The examination of the eye is again very important over here, and we're going to discuss that over here as well in this section. What are the findings that we're going to focus on when we have this patient of a unilateral sudden vision loss? The treatment modalities, of course, depend upon the causative factors. So one should know what is the causative agent or what is the final and the foremost diagnosis in that patient. After making out the differential, you have to look upon the definitive diagnosis in that particular patient, and then you're going to work on that and find the treatment modalities that are available for that particular causative factor in that patient. So when we look at the fundus or the retina of the patient, these are some of the particular pictures that we have to focus on. This is the optic disc that one should know. The pallor around the optic disc is again very important. One should know how to differentiate between a healthy optic disc and a disc of the optic neuritis or any abnormality that has to be detected in the optic disc. Then the vessels are again very important. The cotton wool appearance is basically indicative of a diabetic proliferative disease, and one should know how to basically spot out this cotton wool appearances in the retina of the patient on whenever the fundoscopy is carried out on that particular patient. So the causes of the acute unilateral vision loss can include the branch retinal artery occlusion over here, and usually the variable visual field defects are noted down in this branch retinal artery occlusion. The visual fields are defected in this, and usually in most of the patients, the peripheral visual field is affected in these patients. It is one of the causative factors. The onset is sudden in these patients, and usually it is of the unilateral kind. So although it is usually the peripheral visual field, but in some of the patients, the central visual fields are also affected. In such cases, the embolic causes, we can also go through the embolic causes over here. That can range from the vasculitic causes, the other autoimmune diseases in these patients, and then the hematological causes can also be highlighted in these patients of the embolic diseases. If a certain emboli has traveled towards these retinal veins and has caused the blockages, one should know how to basically deal with that. The autoimmune diseases can range from the giant cell arteritis, and it is one of the major factors of the unilateral vision loss in the old patients. So the examination, as I was already focusing on this fact that the history over here is very important, whether the sudden loss of vision was associated with a painful or with a painless vision loss. The painless causes of the acute vision loss, they include the central retinal artery occlusion, the ischemic central retinal vein occlusion, the retinal detachment involving the macular area, the massive vitreous hemorrhages. So these are the painless causes of the acute vision loss. The painful causes would include the acute congestive glaucoma. On the other hand, we have acute iridocyclitis, and then we have the chemical injuries to the eyeballs over here. So when you have taken the history, making the differential is much more easier after you have taken the history in detail. Generally, very poor vision and typically less than counting finger vision is associated with a lot of these features. Severe visual field constriction is also associated with it. RAPT, that is the rapid proliferative disease, retinal whitening and pallor is observed when you perform the fundoscopy. Compare with the other eyes to know the difference between the normal and the affected eye. So this is how you basically carry it out. Carotid bruit or murmurs, it's again going to highlight any retinal artery occlusions in that particular patient. So the temporal artery tenderness is also noted if there is any scalp tenderness or any scalp is basically, or the occipitofrontalis is affected in that particular patient. That is also noted down, and that is basically indicative of any inflammatory disease in that particular patient. The treatment, usually no treatment is proven consistently to be of value in these patients. Theoretically should be given as soon as possible. Irreversible ischemic damage probably after 90 minutes of the occlusion. Modalities would include the paracentesis, the ocular massage. Diamox is one of the drug that is usually administered. Carbon dioxide enriched oxygen, carbogen, is administered along with it. And then we have the hyperbaric oxygen, selective ophthalmic artery catheterizations, basically plasminogen factors can also be administered in these patients. Always considered the giant cell arteritis, ECR and CRP has to be calculated in these patients to rule out this giant cell arteritis in these patients. So knowing the causes of the acute unilateral causes of the vision loss makes it more easier for us to get to the definitive diagnosis in a patient of the vision loss. So that is the end of this section. Thank you for watching sqadia.com.